you're most concerned about is breathing, then the diagnosis has to do with breathing, and the goal has to do with breathing, and the implementations, which are the things that the nurse does, have to help the person, the patient, with their breathing. Then for the eval, you put whether or not you helped the person reach their goal, and you're not graded on whether or not they reached their goal, just that you tried. So the assessment, the very first thing, comes from when you check out your patient. So your physical assessment. There's something with the patient that you're concerned about them either getting worse or you need it to get better. The nursing diagnosis comes from the book. So you need to look that up in your care plan book and have a related to and as evidenced by statement right there. Now the goal, you guys tend to make this too complicated. So it just needs to be one thing, and it needs to have a time frame, usually the end of your shift. Obviously, if you pick a larger goal, like stopping smoking or finding housing, that would be a longer time period, like a week. And then the implementations, you have to be careful to put things that you can do as the nurse. So an example of something you can't do as the nurse is you cannot order medications. So you can't prescribe the patient antibiotics for their pneumonia. However, you can put to administer prescribed antibiotics because that's within your scope of practice. So in this implementation area, you can either put 8 implementations or you can put 4 implementations with 4 rationale. Okay, so that's how that section's divided up for credit. Now, most of the time, since our patients are not that compliant, you will not meet your goal. And it's okay for the evaluation to put on there that your patient didn't meet the goal. And then what else can you do next time to help the patient improve? If there's something that you thought of later that you didn't use as an implementation, you can add it there. So happy care planning.